Today is Celebrity Skin Cancer Edition because over the summer, several big-name celebrities and TikTok stars revealed that they had been diagnosed with skin cancer. And today we're gonna watch those videos where they come out and talk about their diagnosis, and I'm gonna give you some additional commentary about the diagnosis, the treatment, and how to make the decision if you're diagnosed with skin cancer, what kind of treatment you should get, and how these things can be prevented. For the record, I'm a board-certified dermatologist and a Mohs micrographic surgeon, so I spend a ton of time removing skin cancer from very delicate places on people, their nose, their eyelids, their ears, and everywhere else on the body. So I understand the process, the diagnosis, the treatment very intricately. Skin cancer is an increasing problem in the United States and throughout the world, with younger and younger patients starting to develop skin cancer. And there's a number of reasons for this, but we're not going into all of that today. But we're gonna start with our first celebrity skin cancer reveal, Joe Jonas.
So today I am getting a basal cell carcinoma
in the doctor's
from
office.
my head. Yes, that is a actual little skin cancer guy that has started to grow.
Commonplace.
And now I have to get surgery to remove it. So here we go.
So we're gonna document this process. He's had one layer taken off for Mohs surgery, and he's not showing it to us.
I'm all done.
But he's got stitches
Now
and a bandage.
it's time to heal. Heading home. Make sure to get those moles checked, people.
All right, so Joe Jonas in the doctor's chair getting a basal cell carcinoma removed. Basal cell carcinoma is the most common type of skin cancer. 3.5 million, give or take, are diagnosed in the United States alone every year. Thankfully, basal cell carcinoma almost never leads to death. These do not metastasize, with very rare exception. Basal cell carcinoma requires the skin environment in order to grow, so they tend to grow just where they're planted. Now, if you leave it long enough, then it could metastasize, but the longer you leave it, the more that it can spread through the skin and into the underlying structures of the skin. And if that starts to travel down a nerve or around a blood vessel, you can have more complications, nerve damage, things like that from the cancer itself. Now, basal cell carcinoma, because it is a locally growing cancer, the most common way to remove it from sensitive areas like the face is going to be with Mohs micrographic surgery. Mohs surgery was first pioneered by Dr. Frederick Mohs, and it's an intricate way to remove a skin cancer where the margins are taken very small. Now, if you had a skin cancer on your back, we would just measure it out, go 4 millimeters on every side, cut it out, and remove it with 90 to 95% success rates. With Mohs surgery, we take that first cut and maybe only go 1 or 2 millimeters beyond what we can see with the cancer. The reason for that is we want to spare as much normal tissue as possible when we're removing that from high-priced real estate areas, especially on a celebrity. Now you might be thinking, 1 to 2 millimeters is not enough to remove a skin cancer, and yes, that's generally correct. So what we do with Mohs surgery is once we remove that cancer, we process it in the office, we put it on microscope slides and look at it, and if the cancer goes to the edge of that little thing that we took out, then we will go back and take more. But we map it out like a clock face, so we know up, down, left, right, and if there's cancer only between 12 o'clock and 3 o'clock, for example, we only cut more tissue from that area with another 1 to 2 millimeter margin. So when we check that again under the microscope, we know for sure if we've got the cancer out. Mohs surgery allows for 100% of the surgical margin to be evaluated. So we know the entire periphery and the deep margin of the cancer, that it's clear. And if it's clear, even if it's only clear by 1 millimeter, that is enough for a surgical cure, and Mohs surgery has success rates of 99%. I wish I could say 100%, but nothing is 100% in medicine. There's always the risk of a small recurrence. Now, when you are trained in Mohs surgery, you're not only trained in that delicate removal process with very narrow surgical margins, but you're trained in reconstruction. So this is akin to plastic surgery. We're not putting implants into people, but we do very fine suture work, skin grafts, flaps, all sorts of different creative ways to have an excellent cosmetic result, which is important for all people because our face is what we lead with in the world, and it's how we present ourselves, and we want to avoid big scars when possible. I've had some crazy cases in the clinic where huge cancers on the tip of the nose, and we do a huge flap and everything looks beautiful. Sometimes you can't even tell when the person is fully healed and waits a couple of months. Next up is TikTok star Matt King. Matt King reveals that he had a basal cell carcinoma. Let's watch.
So last week I was diagnosed with basal cell carcinoma, also known as skin cancer.
Yep.
It's the most common and treatable form of it. I'm going to be just fine, but just wanted to share my story on how it all went down. I was concerned about a spot on my leg that I had had for a while. Made an appointment with my dermatologist. That spot ended up being nothing. I pointed out every other random spot on my body I'd been concerned about, and she noticed a spot on my back, right here near my neck, that I had never noticed. Here's a picture of it right here.
Right there.
And
I'm gonna pause the video right here. So if we look at this picture, this is a very faint little pink spot on the skin. It might look like you just had a pimple there, something that's healing, but something like this would be there for a long time. It wouldn't heal properly, and this is probably a very superficial type of skin cancer. Basal cell has superficial types, nodular types that grow in a ball in the skin, and infiltrative types, which have small little fingers that start to grow deep into the skin. Most likely this was a nodular or a superficial basal cell, probably didn't cause any symptoms, and he wasn't aware that it was even there.
And she took a biopsy, called me back a week later and told me it was basal cell carcinoma. I'm gonna be just fine. Once again, I have a surgery scheduled in mid-July, and I just wanted to tell you guys and urge you guys just to be safe this summer, to go get a checkup with your dermatologist and
Good
ask
advice.
them what type of sunscreen you should be wearing this summer. You know, I got that freckly Irish skin. I'm very sensitive to the sun.
He's definitely higher risk with that skin type.
Again, just be safe out there. I'm gonna be just fine. I've always been concerned about the really scary looking skin cancer spots, and I never realized.
I'm gonna pause it here again. Basal cell in the top left corner is what he had, and then squamous cell carcinoma is the second most common type of skin cancer, and it does have a little bit of a risk of metastasis. Now, thankfully, most of them will not metastasize. They will not cause significant problems, but they grow locally where they're planted, essentially, and they can cause disfigurement. They can grow around nerves and blood vessels. They have the potential to be a little bit more aggressive than a basal cell carcinoma, so we do watch out for those, and the risk is a little bit higher if they grow on your lip or your ears for spreading inside the body. Melanoma in the bottom left of this grid is the one that most people think about as being the most dangerous type of skin cancer because it is the one that leads to the most mortality or death in the United States. There are about 100,000 cases a year diagnosed of melanoma, and about 8,000 to 10,000 people a year pass away from melanoma. It's usually going to come in a dark spot from a mole or a new dark spot, and it does need to be treated quickly. There's more urgency with melanoma. Now, the bottom right corner is Merkel cell carcinoma. Thankfully, these are much more rare. We don't see them very often. I've been in practice a little over 6 years, and I've had 4 cases of Merkel cell carcinoma in the clinic, and they almost never turn out well. This is what Jimmy Buffett died of. These are much more rare, but much more aggressive. They have a much quicker time to metastasis inside the body, and they're more difficult to treat. So those are the 4 main types of skin cancer that we treat. Thankfully, most of them are basal cell carcinoma and squamous cell carcinoma.
Realize that what I have in the top left right here is cancerous. So be safe, be smart, go get a checkup.
I do like that he recommended that you go to a dermatologist. If you have had a first-degree relative, mom, dad, or siblings that have had a skin cancer, there is a good argument to be made that you should go and be screened. Now, if you don't have any family history of skin cancer and you're younger, it's a little bit more difficult to make that argument. I generally, and of course I'm biased, think that most people should go get a skin cancer screening in your adult years and then talk to the dermatologist about your individual risk and how frequently you should be following up. But the United States Preventative Services Task Force has not recommended that people get a skin cancer screening the way that they have recommended that you get a colonoscopy when you're 45 or start getting mammograms at the age of 40. So that is something that dermatologists tend to advocate for, but they are looking at it from a purely financial perspective, where if you pay for everybody to get a skin cancer screening exam, the rate of catching skin cancer and treating it does not really cost-benefit analysis weigh out over the whole population. This is challenging because if you are one of the few that do have a melanoma that develops at a younger age, the risk of it progressing to a later stage before diagnosis is unfortunately higher. So I want you to think about your own individual risk factors, your family risk factors. If you're more fair-skinned, if you've had significant sunburns in your youth, then those are good reasons to go and schedule a dermatology appointment, even though it may not be a free service with your insurance company. Determine if it's something that's right for you. I appreciate that he made that recommendation as well. Thank you, Matt, for sharing your story. Next up is Harry Jowsey. So Harry had a skin cancer that he's going to tell us about as well.
Hi friends, there isn't really an easy way to say this, but last week I went to a dermatologist to get my skin checked and they found some skin cancer on me. I'm going to be all good, everything's going to be okay, but I just wanted to make this post to let you know that summer's around the corner. Please wear sunscreen. Please wear it. Please go get your skin checked. If you're a freckly little frog like me, go get a mole map and get your body checked, because you never know. I've had this on my shoulder for like a year or two. I had no idea. So I just want to save and protect one of you guys out there. So go get your skin checked, wear your sunscreen, and be a little bit more responsible, because that's what I got to do now, and it's very scary. Anyway, love you guys. Stay safe.
All right, so Harry does not in that video tell us what kind of skin cancer that he had, but he does seem to indicate that it was a mole that had been there for a couple of years. I did a little bit more online research, and we all know how accurate that always is, and it did reveal that it was a melanoma. So I'm suspecting that this was an early melanoma, potentially melanoma in situ, where it's just in the top layer of skin, just in the epidermis. Now, if it has started to invade the skin, then we start to look at how deep it's going, and the fact that he was very reassuring that it was going to be fine means that if this had started to invade, it was still very, very thin and was not going to require chemotherapy or radiation. Once a melanoma starts to get over 0.8 millimeters deep, yeah, that's not even a full millimeter, then we start to look at doing lymph node biopsies, we start to look at chemotherapy and radiation and other forms of treatment to help prevent metastasis. So this was caught pretty early on him, even though it had been there a couple of years. So thankfully, he's going to be okay. Now, this mole for him was probably a new melanoma from the beginning, because he's an adult and this popped up as an adult. He said it had been there 1 to 2 years, and thankfully he got it caught, got it treated appropriately. Now, for most melanomas, the treatment is going to be a surgical excision. Like we talked about on that first basal cell carcinoma, we take a standard margin of 0.5 centimeters or 5 millimeters all the way around the melanoma if it's a melanoma in situ. Now, if it's an invasive melanoma where it started to break through into the dermis or the second layer of skin, then we're going to take a full centimeter around the outside. Now, there are some doctors that are trained in Mohs surgery for melanoma. We still tend to take bigger margins than the 1 to 2 millimeters that we would for a basal cell, but it does allow us to take more narrow margins. Not every Mohs surgeon in the United States performs Mohs surgery for melanoma, because it is a little bit newer technique, requires different staining, but it is a really excellent option if you are a candidate for it and you have a doctor that's experienced in performing that procedure. Next up is Joey Graceffa, revealing that he had a basal cell carcinoma.
So I have skin cancer. That's fun.
Right away,
no,
I can see it on his nose.
Actually, you can see it right there on my nose. It looks really crazy right now because I had to get a biopsy done to determine that it was skin cancer. I've actually had this mark, this redness on my nose for maybe the past like 1.5 to 2 years. And I've had several dermatologists look at it and both have said it was a broken blood vessel. But I recently went back in because when I was in Japan, it like scabbed over and I was like, why is it doing that?
So this was very astute of him. The fact that he'd had a spot and it was misbehaving, it had bled, it had a scab on it, he knew that was not a normal thing, even just for a regular broken blood vessel in the skin, and he went and had another opinion. Now, why was this diagnosis missed? Because it was probably a basal cell carcinoma the whole time. Well, first, if it's very small, a basal cell carcinoma does have little blood vessels that grow over the top of it that can look like a spider angioma. This is a normal little red mark. They're common to see in kids if they get a bump or a scrape. And in his age, even though we are seeing more skin cancer develop at younger ages, it's still going to be uncommon for a person of his age to develop skin cancer. Now, I don't know if he had a history of using tanning beds or spent a lot of time in the sun, but he had a risk, obviously, and it just wasn't really apparent to the dermatologist that he had seen before. I tend to use a tool called a dermatoscope to really get a magnified view of a lesion, and if it's not obvious that it's a basal cell, we might watch it for a period of 6 months to a year, knowing that these typically are slow growing, that they don't metastasize in the skin, and that may have been the communication that was given to him is, let's check it, let's have you come back in 6 months or in a year. And so the fact that it misbehaved and he got a second opinion, I love that.
And she looked closer and she's like, yeah, I kind of want to do a biopsy on this. And she did. I literally passed out in the chair when the biopsy happened. Not because it like hurt or anything, but just because I am so queasy when it comes to like anything gore or like blood related.
It's not uncommon for people to have a vasovagal episode where they might pass out during a biopsy or a needle stick.
And I just passed out and I woke up and they had a Capri Sun and gummy bears for me. And,
we like to hydrate the patient and give them some sugar. It helps wake them up, helps to get them feeling better quickly.
You have skin cancer, and I was like, oh my God, what do I do? And I'm currently now exploring my options of how
Let's
to
see
take
what the
care of
options
it.
are.
They recommended something called Mohs surgery, which is basically just cutting it out of my nose.
We've talked about the intricacies of Mohs surgery already.
She was explaining, I was like passing out on the phone. I was like, and how long does that take? And they're like, oh, it's like 3 hours. It's like 45 minutes for the first pass, and then we'll review. And if I passed out from just 40 seconds of the biopsy, how am I going to last 45 minutes? I don't.
All right, let's talk about this. So during Mohs surgery, the removal does not take 45 minutes. The removal takes a little longer than a biopsy, maybe 5 to 10 minutes to cut the spot out. And then we put a bandage on the patient, but it takes about 45 minutes to process the tissue, to put it on the microscope slides, to stain it, and then have the dermatologist look at it and read that slide. So it was a misunderstanding. Obviously, the 45 minutes is not time that he's actually being worked on. You're only being worked on for a very short period of time, then you get a bandage, then you can read a book, you can watch TV, you can browse on your smartphone. So you're waiting most of that time, and they check, at least we do, we always check and make sure the patient is remaining numb. If we need to add extra anesthetic, we will, so we can stay ahead of that pain and not have them feel additional needle sticks. Now, if we do see that the cancer is positive and we have to go back and cut more, it only takes a couple of minutes, but then another 45 minutes to process. And if somebody, God forbid, has to have 3, 4, or 5 stages of Mohs surgery, every time they're going to wait about 45 minutes, and that's why you can be there 3, 4 hours sometimes. Then you have to get stitches. Usually getting stitches is going to take longer than removing the skin cancer itself.
Freaking no. So I'm looking at other options right now.
What are these going to be?
There's like some natural treatments that I've read about, like castor oil.
Nope.
There's aloe vera.
Nope.
There's another, like, I think bloodroot or something. I don't know.
Nope.
That one seemed kind of scary because it actually burns and can also leave a hole.
So aloe vera, castor oil, no evidence that they can treat and cure skin cancer reliably. Bloodroot, I've seen people get horrible burns on their skin. And also, we're not checking margins with bloodroot. If this has an infiltrative basal cell type pattern and is growing deeply in the skin, bloodroot's not going to get that out. You're going to remove the surface of the cancer. It's going to remain growing under the skin. It's going to pop up in a few years and be 10 times worse to treat.
Where it's treated, but apparently it like can kill it quickly. I don't know. I'm not a doctor. I'm not recommending anything. I'm just
Thank you. Don't recommend those.
What I've found and I'm figuring out. But one thing that I did find that I'm really considering is radiation treatment.
So radiation treatment can be a successful way to treat basal cell carcinoma, but I generally don't recommend it for younger patients. For one, again, even with radiation, we're not checking margins. There's no tissue that can be sampled to prove that the cancer is gone. The cure rates on radiation are often very high. However, anytime you're exposing yourself to ionizing radiation, it can increase the risk of a new skin cancer developing in 10, 15, or 20 years. So if you are young in your 20s, like Joey is, the risk of another skin cancer developing in the future is higher in that area. But I recommend radiation sometimes to my patients who are 70s, 80s, 90s, because we have a little less worry about what's going to happen in 20 years, to be honest with them. We take this on a case-by-case basis, considering the goals of the patient, their individual health, other health conditions, and what they personally want to go through. But I rarely, if ever, recommend it to a patient who is in this age group.
That's just targeted for skin cancer. So yeah, this is all very new to me, and I'm not freaking out like maybe I should be. I don't know.
You don't need to.
Being very level-headed about.
So we covered some of the ins and outs of his particular cancer. I don't recommend these natural alternative therapies. Radiation might be an option, but not generally in this age group. That's my personal recommendation. Mohs micrographic surgery is the gold standard treatment, and it is the most likely to cure that cancer, and also the cosmetic outcomes are great. Now, Joey did provide us with an update after his cancer. Let's watch him remove the bandage and see what things look like.
It has officially been one whole day since my skin cancer removal, and today I'm going to be taking off my bandage to see.
So we typically recommend patients take the bandage off 24 to 48 hours after surgery.
The stitches or the incision at all, just because I get super queasy. I'm dreading this right now, but
he's got a big pressure bandage on there, which is normally what we would put on right after surgery, just to help limit the risk of bleeding and oozing through the stitches.
I'm imagining the worst. My face feels very swollen.
He does have some swelling on that side of the face, and he's got a little distortion of the nose. You can see that that nose is being pushed partly from the bandage, partly from the stitches, and all the swelling that he has.
I wish I could just leave the bandage on the entire time and not have to look at it until it like healed.
All right, let's do it.
It's okay. It's okay.
It's gonna be okay. Let's peel that off. Let's look at what's going on underneath.
Like shaking. I don't want to do that.
Come on, Joey.
I'm really scared about my skin here. Oh gosh.
Just carefully peeling the bandage off. Taking his time. We got a little peek at it. All right.
Oh my gosh.
Okay, let's take a look at his suture line here. So this area, they were able to do a linear closure, just straight up and down. So this means it didn't cross over the alar groove, that little groove where your nostrils flare out. The straight line closure is gonna look great when it heals up. If this had come down a little lower, they may have had to do a flap where they advance some of the skin from the cheek over onto the nose, so it ends up being like a little L-shaped scar. I've done tons of those. I've done these linear closures. Based on how this looks at 24 hours, I can tell he's gonna have a great result. It's always gonna be scary the first time you look at your stitches because you're not used to having stitches on your face. You're not used to having a hole in your face. But I really appreciate that guys like Joey and the other ones that we've looked at have been able to come on social media and share their story, because skin cancer is increasing in younger populations, and the ways that you can help to prevent and avoid that, especially in your youth, is to avoid significant sunburns. Now, one of the most effective ways to do that is with clothing. That's rash guard shirts that are UV protective, that's wide brimmed hats, and those don't have to be reapplied. There's no concern about chemical exposure there. You can stay out of the sun in the hottest, brightest parts of the day. If you're gonna be at the beach, make sure that you're staying under shade as much as possible. And if you are going out in the sun, make sure that you're wearing sunscreen. Whether it's a chemical sunscreen or a physical sunscreen that contains zinc or titanium, find one that you like to use and use it consistently, because there is a significant amount of data that proves and shows that consistent use of sunscreen will decrease the risk of developing skin cancer at all stages of your life. So this is something that most of these guys hopefully will start implementing if they haven't been at this point in their lives. But if you haven't had a skin cancer, consider yourself lucky and take additional steps to prevent skin cancer in the future. These celebrities and TikTok stars are not the only ones that have revealed a skin cancer diagnosis. Khloe Kardashian had a melanoma on her cheek, and Hugh Jackman has had, I think, 4 or 5 basal cell carcinomas on his nose alone. Clearly he has an amazing surgeon, because you cannot even tell. Guys, thank you so much for watching the video. I am passionate about taking dermatology care to underserved populations, and when you watch videos and purchase products through the links in the video description, that affiliate revenue helps me to go provide free dermatology care to uninsured patients and rural communities and homeless populations. So thank you for watching the videos and for your support. Check out the channel for some of our mobile clinic videos where we do that charitable care, and I'll see you guys on the next video.